Hello. Hi, everyone. I'm Clara Watson. I'm a physical therapist. I'm part of this team over here that works at the skilled nursing facility. I know some of your faces. Please bear with me. I'm not a public speaker. I haven't done any of this since college where I had to have a class and do something like this. Um, Feel free to raise your hand if you have questions. I'll leave room at the end to do questions as well. Some of you have done this class with Nick, so he's gone over a lot of this information, but I'm here to reiterate it because it's important. So we'll get to it. So here are some, nope. And then I'm going to click here. Nick, help. Did I do it wrong? Hmm. No, it's a good start. It's fine. I know, I see that. Sorry, everyone. Uh-oh. No notes for me. Okay. All right. No notes. I'm winging it. That's okay. Oh, yeah, I have that. That's right. You're right. Okay. Well, I know it's a no, that's fine. I wouldn't know how to fix it either. Technology is not my forte. Okay. So now here we are. Okay, facts about falls. So this is just a little bit of statistics, right? More than 1 in 4 older adults fall each year. And falls are one of the leading causes of injury related deaths among adults aged 65 and older. So each year, an estimated 646,000 individuals die from falls globally. Yeah, and then injury from falls results in like over 3 million ER visits. And once you fall once, you're 2 to 3 times more likely to fall. Yeah, well, but there are things that we can do to change that. So that's why I'm here. So the research demonstrates that access to exercise and balance training programs, such as what Nick is offering, reduces your risks of falling and injuries from falls. And I'm not saying this to like really scare you, but I want you to know that how serious this is, right? We're having a lot of falls in the community. And this is one of the reasons why I'm doing this is because there are things we can do to prevent it. A lot of times you need motivation to make sure that you're combating these things so that you take this seriously. So that's why we're starting with the hard hitters. So some risk factors that some we can control, some we can't, some things we can manage. So some intrinsic factors are age-related changes. As we get older, some things become more impaired, vision, hearing, and just our balance and our strength. Vision, right? You can go get your eyes checked, make sure that your prescription is updated. Hearing as well, we get like a buildup of earwax. Our inner ear is important for balance. And so if we are just allowing the wax to build up, and sometimes the nerves that are sending input, right, of how your head is moving in space can inhibit that ability to sense where you are and it increases fall. So those are 2 things you can do to just make sure that you're staying ahead of the game. Chronic conditions. So a lot of times we have comorbidities, more arthritis, more pain, more stiffness. Diabetes, you'll get more neuropathy in your feet, and that's another component for balance. If you have less sensation in your feet, less feedback, that actually tells you where you are in space again, right? And then if you're starting to lose your balance, you get outside of your base of support too soon or too quickly for you to sense, and then you're already on your way, right? So that's why making sure that you're on top of some of those things, right? Some of the even like high blood pressure, low blood pressure, diabetes, making sure that you're managing those with your doctor is important. Which brings me to my next thing, which is medications. As you are just as in charge of your health as your doctors, a common problem with older adults is taking a lot of medications all at once. And if you're not aware of the side effects, then sometimes you're hit with something, you don't know what it is, And then you just keep going on with your life because you don't realize that it's coming from your medications. They're bringing that up to your doctor's attention. There's a lot of different types of variations of drugs that you can manage your comorbidities with that might not have those same side effects, but also making sure that your doctor, especially if you go to the hospital for something and then you go to the skilled nursing and then you go back home, but maybe this nurse wasn't aware that you were already taking this medication. They're all busy, so they're doing these things. So it's important for you to pay attention to what medications you're taking, why, right? And then bringing that up with your doctor if something is kind of off, right? Environmental hazards. This is something I know Nick has talked about. This is something that we can change, especially living in the facilities here. You have those grab bars and things at home. We can keep a clean space. Don't ask me if I demonstrate this in my real life, but keeping the clutter off of the ground, right? Making sure cords aren't in your way, that if you have throw rugs, which we never recommend, right? Those are a tripping hazard, but if you are gonna have rugs, making sure that they're taped down and you're always aware you're stepping up and over, your assisted device is going up and over, okay? We'll talk a little bit more about those things in the coming slides. So let's get into it. The home modifications, remove those obstacles. Oh, shoot, okay. Throw rugs, lighting. So just like I said about with, making sure that you're up to date with your prescription for your vision. When it's darker, our vision is always a little bit worse. So a lot of times we have to get up to go to the bathroom as we get older too. Making sure you have a light on, a night light. Make sure you're doing everything as safe as can be. You have your assisted device nearby. Don't walk to the bathroom in pitch black. Your balance is going to be worse. You might run into things, and that's a given. Handrails, we're lucky, I think, in most everywhere here. The rails are in the showers. They're by the toilets. Use those. Just make sure they're nice and stable. And then avoid wet floors. If you spill something, just make sure you pick it up right away, right? Or have someone come. We have these, nice people that come through. And then I don't know if they have this already, but like the non-skid stickers in the showers are always a good idea. Making sure that the mat outside of the shower or the bath is non-skid, so it's not going to slip out from underneath you because you'll be wet. The floor will be kind of wet, so having those things in place is always important. And then, don't take unnecessary risks, like standing on a chair to grab something overhead. Because I feel like, I hope that you don't do that because we have facilities and people we can call over to help. I don't know how quick they are, but I'm hoping they're there to help you. It is unnecessary. You can wait to get that thing later. Don't put yourself in a position where it's going to increase your risk for falls. Assisted devices. Okay, this was brought up to me actually by one of your neighbors who I've been seeing in physical therapy. She mentioned a lot, and I've seen it too, that when people are walking around with their assisted devices, especially those 4-wheel walkers, you're walking out here or you're walking like this, right? And it's nice because those 4-wheel walkers get you where you want to go. It is not safe to be walking that way because of your leverage, right? If you're up here and you start to buckle, there's no leverage for you to actually use those armrests to help you get back up, right? And then if you're walking out here and then you lose your balance, guess what? Your walker is all the way out there. There's no way that you can help yourself get back up. So one of the nice things with these walkers, which you may not be aware of, is that those handles can raise and lower. And so I wanted to just talk a little bit about, and I can help you too, Nick can help you as well, but where the height of the handle should be. So if you have your assist device, if you guys can see me here, the wrist bone, that's about where that handle should be. So when you're walking, you have like a 15 to 20 degree bend in your elbow here. And then as you're walking here, even if this is a good height, right? You need to make sure that you're standing close to the walker and you're trying to be as tall as you can. So if you have like a dowager's hump or you have like scoliosis, something that's preventing you from standing up, then adapt that walker more appropriately. So even if you have to be here, that it is close to you and you still have that leverage, okay? That being said also, and I'm gonna skip down, locking those brakes and then walking away from that walker. If you feel like you need the walker, then you should be taking that with you, turning, locking those brakes, and then sitting down. As I see often, walk, throw that to the side, and then, okay, we're going to my chair over here. All right, keep it nearby because then it's far away from you. And then if you have to walk over there to get it and then you trip or something, right? Even though I know a lot of you are stable enough because you're using the 4-wheel walkers, just don't take the risk. Just get in the habit of it so that it doesn't become something that's a problem. And then locking the brakes. So when you sit, when you stand, when you're doing something where you're going to be putting pressure and relying on that walker to help you, lock the brakes in place. And then when you're ready to walk, unlock it. And then transfers. If you're sitting and standing using the assisted device, one hand should be on whatever is stable that's behind you. Because if you start to fall with both hands here, you're just going to fall, right? If you have your hand always behind you on whatever's stable, and then you stand and you start to lose your balance, you're already a little bit more stabilized here. All right, good habits to get into. I know a lot of you are very agile. You're doing great. These are just safety things that you could start to implement. Let's see. Oh, and then cane. So if you're using a cane, same thing applies. Like if that cane is out here a little bit, you still use that wrist here. If you have one side, like one knee, one hip, that's more painful, contrary to popular belief, the cane should be in the opposite hand because if anyone's good at I guess it's physics and leverage, right? If you have your cane in this hand and this is the side that bothers you and you walk through, you have more support here because you're leaning away from that hip and that leg as you go through. Versus if you're on this side, then you have to put all of your weight through over here as you're walking, and then you're just putting yourself at more of a chance to buckle or something like that. If it's just for a little bit of stability, dominant hand is fine. Okay, exercise. The bread and butter. This is what Nick and I love to talk about. There's a lot of reasons here. And of course, as like a personal trainer, fitness coordinator, and physical therapist, we're of course going to harp on strength and range of motion and all of those things. But there's a reason for it. And I feel like a lot of times people as older adults, you feel like, I've already, or like I'm losing this muscle mass. I have this pain. I'm doing this. I'm fragile. I can't do this. But no, we can definitely strengthen and you can load those muscles. And fortunately, even in my profession, we're chronically underloading the older adults because, again, that mentality that I'm fragile, I can't do it, stays with us. But we have just as big of a capacity to strengthen and lift weights and do all of those things to help build up strength, improve your bone density. A lot of those, if you guys have osteopenia, osteoporosis, weight training, and walking, loading those joints and those bones helps make sure that those bones stay nice and solid. You have good bone mass. And it helps with that osteoporosis with using dumbbells, right? Those muscles are pulling on those bones to strain it a little bit and apply some of that pressure. Flexibility, even if you have arthritis and your knee's been bent for a long time, you can work on those things. You can get better flexibility. And with better flexibility, better strength comes improved balance, comes improved confidence, right? Ability to do more of your functional things, right? And so a lot of times you have to ask, and this is something I've heard, the HR person said this to me, and I hated when he said it, but I'm going to say it now too, is find your why, right? Like, why do I need to strengthen? It's hard for me to get out of this chair without using my hands so heavily. It's hard for me to walk all the way to the dining area without feeling like I'm going to fall over or just feeling so out of breath when I get there, right? Endurance is another thing that you can improve just with exercise and consistency. So I touched on this before, but with balance, there's kind of 3 specific components that are that help with our balance. One is vision. So a lot of times if you're trying to balance and you hear people focus on something and then you can stabilize a little bit better, right? The vision and knowing where you are in space here, That helps with balance. Inner ear, when your head is turning, we have these little hairs in there that help us with our stability. And then the proprioception, the feedback through our feet to tell us where we are in space. And so all three of those things are really enmeshed in balance. And then having the strength and the flexibility along with it to be able to do something with that feedback of where you are in space, right? To catch yourself or to prevent yourself from falling. So, I mean, I think that's about it. So I was told potentially some of you might like research. So I have research slides next. These are all from the American Physical Therapy Association. This had percentages in it, so I really liked it, though it is particularly for people in nursing homes, but just one thing, single intervention, that was just strengthening. That's all I did, is strengthening. Their recurrent fallers were able to reduce the number of fallers by 36 to 41%, which is pretty significant. And that's just doing one thing, right? They weren't addressing medication. They weren't doing other modalities. It was just strengthening. They didn't do it with cognitive impairments, which is, that's a little bit of a harder barrier to push through. But that was pretty interesting. Same thing, decrease the reduction of falls with exercise versus just going to the doctor. I mean, they're all a little bit different. This last one, though, doing something that is going to help with aerobic capacity, strengthening, and balance was the most successful at reducing falls and injuries. A little bit more of the same. Got to add physical therapy in there. Oh, I kept this one in there, the top one, because I thought it was interesting that all they did was calf strengthening, right? Those little heel raises that everyone scoffs at. And that significantly, just that one thing, improving the strength and helped with their functional performance and their balance. So calf strengthening, that's something easy that you can do at home. You're cooking or something, you can do some calf strengthening. And then this next one, is specifically about the walking aids, the assisted devices that I mentioned before, right? So using walking aids is a risk factor for future falls among the older population living in a residential setting, which you guys, and a lot of it can be explained by the spatiotemporal gait pattern, increased age, psychotropic drug intake, which we've talked about. So this finding of this research study supports the aim for extensive training and instruction on the proper use of walking aids for adequate and safe gait patterns, because that helps with fall risk, right? That's why I'm telling you about where your hand should be and why you shouldn't be out this way, because it's important. Strengthening your core. Muscle strengthening and balance exercises for individuals. So making sure you're doing the strengthening that you particularly need for your body. Decreased falls by 35%. All right, next. Same. If you guys want a copy of this, I'm putting it on Nick. He has a copy of this, so he can make a copy for you. All right, so the how to fall. This is interesting because it's a little bit hard when you're in the middle of falling to tell yourself how to fall. But there are a few key things that you can try to think of. One is stay loose. So if you're already falling, the tendency is to want to be super rigid, and because you panic and it's like, oh, what do I do? But when you fall on the outstretched hand, or you fall and you like compress too much for your femur. That's how hip fractures happen, right? Try to stay bend from the knees and the arms and the elbows, right? And then land on more fleshy surfaces as you can instead of straight on the bone. If you practice what we call ankle hip step strategies with your balance activities that you do when you're practicing balance, if you're outside of your center of gravity, the first thing that happens, right, a little bit is you use your ankles. Okay, so I'm a little bit off balance. I can use my ankles. The thing that people skip often is the hip strategy. So if you're a little bit further outside, your hips can chime in to make sure that you bring yourself back too. This is something that when you're in balance class, it's good to know. So you're starting loose. If you can bring your hips back, right, that can help you if you're going forward to get your center of gravity backwards. Same thing if you're going backwards, even again, hips go back, shoulders come forward. You can help prevent yourself that way too. And then the third one is if you're really far outside, then of course you have to step. So then another thing that's good to train is if you're losing your balance, don't do little steps here. You take a big good step here, which is why flexibility and range of motion is important, and strength, right? You're losing your balance. Get yourself stable, wide base. Good. Okay. Got that? Okay, and then getting up off the ground. Again, I know Nick went off over this. If you fall, first things first is just assess. Give yourself a moment, because a lot of times we're shocked, right? And we're nervous about having done that. Give yourself a second to calm down, and then just give yourself a pat down. Make sure that your head, did I say protect your head? Because that's a pretty important part of this. I'm sorry. Okay, see, I'm not a good protector. So protect your head, important, right? Like traumatic brain injuries, right? Sometimes people hit their heads, they're fine. I had a patient where weeks later she was noticing that she was having this, or actually she wasn't noticing, her husband was noticing that she was a little bit off, and they went in and got a brain scan. And from those 2 weeks ago where she kind of hit her head, she had a slow bleed that was happening. So if you hit your head ever, make sure you get checked, even though you feel like you're okay. All right, but if you're falling forward, right, just protect your head. If you can remember to do this, that's fine too, but turn your head to the side so you're not just going to hit your forehead down. And then if you're going backwards, tuck your chin down to keep this from whipping into the ground behind you. Okay? Oh gosh, I forgot that point. I'm glad it came up this way. Okay, so when you're on the ground, if you're on the ground, hopefully never, give yourself a pat down. Just make sure that you're okay. And you can move your fingers, move your ankles, your wrists, your arms, right? Just kind of assess how it is. If something is off, I know you guys have those buttons. Use them. Always wear them, even if you don't think you need them. They're provided. They're free. They have them available for you. I know one of my patients, she lost hers. She came up here. They got her another one. And again, in the skilled nursing facility, we had a gentleman who had one of those. He left it on his bedside table, and then he fell elsewhere in his home, wasn't able to get up or move, and then he had to wait for someone to find him. So worst case scenario, wait. We're a small community. Someone will find you if you can't get up. We have those pull things. You have those things. So if you can't get up, don't panic. Just make sure you're okay and try to stay calm. But a good way, if you are okay to get up, is to get onto your side or onto your stomach so that you can roll over onto your hands and knees, crawl to something that's nice and stable, and then you get into a half kneeling position. So that way, the stronger leg usually is going to be the one that's having to push you up. But if you get here and you have your arms on the armrest or the bench or something that's here, you can push yourself up with all four. This leg is usually the one that's doing a lot more. So if you have one leg that's stronger than the other, use that one. And then just push and get your bottom up there. And then just reassess yourself there, see how you can do, and then you can stand up. Easier said than done, but potentially, yes. Hold on. Back first. No, front first. Yes. Oh, yes. Wave your hand at me again if I am speeding up again. And then, did you have a question, or were you just helping me see her? Okay, thank you. Would you like me to say it again? Okay. So, when you're on the ground, wiggle your fingers, wiggle your wrists, elbows, shoulders, any toes, ankles, knees, hips, kind of just get a little check. Check your head, make sure everything's okay. You can move your neck. I was starting to go fast again. I could feel it. Okay, and then when you're there, depending on what position you are, you can roll onto your side, push off of your elbow, get yourself into the hands and knees. Or if you're more comfortable lying on your stomach, and then you push yourself back onto your knees here, crawl to something sturdy. The four-wheel walkers, unfortunately, I mean, if they're locked, they could work, but I would, if you were going to use them, I would ram them up against a wall so that they're even more stable. But a regular chair or a bench or something low is your best bet. Couch even if it's harder for you to get out of. Those tend to be a little bit lower. Then when you're on your hands and knees and you get there, you put one leg up, so you're in a half kneel position. So one knee is on the ground and then the other foot is on the ground. The stronger leg is usually the front leg because that's the one that's going to really be pushing you up. So if your left leg is stronger, get the left leg up if you know. Okay, and then once you're there, push through your hands and both legs, even get off that back toe, and just kind of turn yourself so that you can sit onto the whatever it is that you're at, the stable thing. Does that make sense? The hard thing is that you never know if you can do it until you practice, which is something physical therapists like to make people do, and a lot of times I get a no, I don't want to do that. But what I was going to say is that I talked to Nick about this, and I don't know if we're going to do it, but we could, if it's something that you guys request, we can try to do a little bit of one-on-one stuff too as part of this fall prevention class to see if, assess how you're doing. Nick is strong. I'm stronger than I look. We would be able to get you up if you were unable to, and then work on those things that you need to be able to get off of the floor to do that. But our goal is for you to never have to do that. But it's good to practice. Because if you find yourself in that situation, you'll have already gone through the motions of doing it. And then usually it comes a little bit faster because sometimes we're panicking on the ground. Okay. Am I boring everybody? Okay. Oh, yes. Sure. Okay, Nick, you want to fall and get up? Can I steal this from? Okay. Yeah. Yeah, I have to go up here, huh? Are you actually gonna fall? No. Okay. Oh yeah. I can move. I'm still slightly young. I know. That's what everybody says. We know, though. We know. Actually, I don't know how old you are, but I'm not in my 20s anymore. So I've fallen. Okay. So then it's like, all right, just rest. I'm doing okay. You can kind of just, all right, are my feet okay? You can kind of move up the chain a little bit, right? Elbows, shoulders. Okay, I can move these things. Okay, head is fine. I can move my neck. I feel okay. Back is fine. Okay, so from here, you have to roll onto your side. So if I'm going to go to my left, you push with your right leg and reach with your right hand. So that way you can get yourself over, reach, push, and get yourself here. Then you can get your elbow down on the ground, this hand here, get up onto your forearm. Okay, and then from here, then you have to roll yourself over onto your hands and knees. Okay, some people find it easier, I don't know why, but if you're here, then you can push yourself back onto your hands and knees. Okay, that's why I say easier said than done. It's the best way to do it, but it is tough, which is why it's good to practice. And then you get yourself somewhere stable. I don't know why I have that still. Okay, and then you put your stronger leg here. You could even put yourself a little bit more at an angle so there's less excursion for me. Back toe up, push, and then get your butt up on here. Okay, and then you can move yourself here and then reassess and see how you do. Is that helpful? Did it look easy, everyone? Okay. Okay, does anyone want me to do it again or do anything up here before I go? Okay, good. Is there another question? Yes? Yeah. So what I would say is I would get yourself to just like a curb and like get yourself out of that situation and then sit down. Just get yourself, even those, the little if you're in the parking lot, dividers or whatever those are, not the things that you park at, but or like right before the store, unless it's crowded and there's a lot of cars going. I would just first get yourself in a place that's safe, right? And then so you would have to just get yourself onto all fours and then get yourself there and then just sit. And then you can call for help, ask someone for help. If you're with a friend, don't make your friend pick you up off of the ground. Have them go get some help. Unfortunately, yeah, we're going to be in some circumstances like that. There are some ways like we could try, if you have your four-wheel, if that's like the worst case or that's the only thing that you have, if you lock those brakes, you can still kind of do that. The hard part is that the handrails are up here, so you'd probably have to go get your forearms. I mean, I guess the seat is all the way up here, so you'd need your forearms here, and then get yourself up, get one hand onto this thing here, and then turn yourself around. But it's just a little bit more awkward, but if we practice, it's something we can do. Does that answer your question? No, it doesn't. If there's nothing for you to do, get yourself to a safe space. Get out of a place where cars are going to run you over, and then sit. If you can't move, you can't move. But get on your hands and knees as best you can with those techniques. I hope you're never in that situation where you don't have anything, anywhere to go. You're in the middle of nowhere. But likely, especially in this area, just get out of the street if you're in the street. Sit on the edge of the walkway and then wait for help. Yeah, yes. Mhm. Mhm. Yeah, okay. So she asked if you are by yourself, what's the best way to, if you're on the ground, to get yourself into a standing position, which is a good question. I would still say half kneel. So if you're falling, you get yourself hands and knees. Yeah. Maybe I should just stay up here. Okay. And then get this arm here. I see. This is probably answering her question. Thank you. I would use your hands on this knee, still back toe, right? If you can be by like a wall or something stable next to you in case you lose your balance, but push up with your knee and get yourself there. Does that answer your question better? Okay. Was that helpful? Okay. All right. Great question. Anything else? Okay. Hmm. Perfect. Mm-hmm. You're saying you're here and then you get up onto your knees? Okay. Oh, like you can get here and do this? Yeah, that's amazing. That's hard. I mean, if you can get up in any way, that's fine. This is the safest way to do it in general, like the easiest way to do it. Because that is asking a lot. If I came up here and I said, get onto your knees, everyone push yourself up and get up, right? And even I lost my balance there. It's a hard sell. Yeah, but if you can do that, all the more to you. Just make sure that you're not, when you get up, you're not going to fall over or anything. Okay. Anything else? I mean, because this is basically the end of my presentation. I'm going to open it up to questions. Yes. Yes. Oh, no. That should be remedied. We should talk to someone about that. Mm. Oh, I see. Yeah. I mean, that's good. They called someone. I don't know what the staff does here if there's a fall. If they might automatically call the ambulance anyhow. But that should be something. Have you brought it up to them about having an actual call button that comes up? Okay. Well, we should bring that up somewhere. But yes, pendant for sure, firsthand experience. And I know a lot of people who don't live in an independent living or assisted living and they, fall at home living by themselves and they have to wait for someone to come check on them. So because we have, it's great that we have these pendants. Because we have those, use them. Just make sure you have that safety just in case. Any other comments, questions? My last slide is just basically go to Nick. It was his personal trainer. Sorry, he's a fitness coordinator. I'm sorry. He's a fitness coordinator. He's in the gym. Crystal is my director, the director of rehab. If you guys are interested in outpatient physical therapy, she would be the person to talk to. She is, of course, very busy with the skilled nursing. So I know that our turnaround time hasn't been very quick. And I am the primary outpatient physical therapist there because I have a lot of experience with outpatient. And a lot of them are a little more just skilled nursing, but I worked outpatient before I came over here. So please let Nick know if you're disgruntled about us. We'll try to get back to you as quick as we can. Sorry, Nick, I'm putting a lot on you, but this is your class. So, but Crystal is our director of rehab. So if you want physical therapy, she can direct you in the right direction, put you in the right direction, and that's me. And then it's more questions. Anybody else? Okay. If you have more questions in the future, feel free to ask Nick. And he can find me too if he can't answer him. He knows a lot of this stuff. I looked at his packet from whatever he presented earlier in this class, and it was a lot of this stuff. I have a little bit more experience with some of like the transfers and seeing these people after they've had these falls. So I can answer maybe some specific questions, but he can point you in the right direction. You guys know where he is, right? You know where the gym is? Okay, good. Anything else? Okay. Well, thank you for having me and for listening for this long. I'm sorry. I didn't know I